As the global coronavirus pandemic grew in early 2020, the consequences for millions of migrant workers, often living in less than ideal conditions, largely went unreported. For several months, we followed one such group in Singapore, where the authorities at first struggled to contain a dramatic outbreak of infection in workers' dormitories. Things did improve, but the experience left its scars on those who lived through it.
Across the world, some of the people hardest hit by the COVID-19 pandemic have been migrant laborers.
কোম্পানির কবে কাজ শুরু হবে কি হবে না হবে আমরা এখনো বলতে পারতেছি না।
In Singapore, the government was initially praised for its handling of the pandemic in the general population. But then an outbreak in worker dormitories caught it by surprise.
This is by far Singapore's largest humanitarian crisis ever.
As infection rates soared, more than 90% of those affected were men living in such facilities.
You have so many workers put together in squalid conditions, so it was a matter of time before it exploded in the dorms.
আমি আপনাদের দেখাচ্ছি এইখানে করোনা পজিটিভ সবারই।
A year ago, people in power began following a group of workers at the heart of the crisis. This is their story.
তো আসলে অনেক কষ্টে আছি, দোয়া করবেন আমার জন্য।
Singapore is host to hundreds of thousands of migrant laborers like Joel Mia. They're vital to the country's economy, taking on low-wage jobs typically shunned by locals. Joel arrived from Bangladesh in January 2020. He started work at a construction site, but had to stop just 3 months later.
আমি সিঙ্গাপুরে এখন কাজ করতেছি না, আমি তো টাকাও পাচ্ছি না। আমার পরিবারের জন্য চিন্তা হচ্ছে যে কি করব। আমার একটা মেয়ে আছে, মেয়েকে স্কুলে ভর্তি করানো দরকার।
Joel's plight was not unique. Like much of the world, Singapore found itself grappling with a strange new coronavirus in early 2020. And while the country's early response was widely lauded, trouble was brewing away from the public eye.
With so many things happening at the same time, the marginalized communities slipped by under the radar. So what was going on in the migrant worker dormitories was, to a certain extent, not prioritized.
It was no secret that Singapore's migrant workers often lived in cramped, sometimes unsanitary dormitories. These were ideal conditions for the virus to spread.
Do you remember what is the figure in this case?
In March, a local NGO even sent an open letter to the press, warning of the risk of an outbreak. It received no response.
Singapore's the kind of place where there's not been a tradition of the government listening to what civil society is proposing. The alarms that we raised prior to COVID-19 hitting the dormitories were largely ignored.
There appeared to be other early missteps.
There was that infamous circular that came out from the Ministry of Manpower on February 19th, discouraging employers from bringing asymptomatic or pre-symptomatic workers to the hospitals for testing. And unfortunately, as you know, when you don't test, you're blinded. You don't know what's going on.
Then came the discovery at the end of March of Singapore's first dormitory cluster. 4 workers living inside this massive complex tested positive for the virus. Days later, the government took what was then considered a drastic step. It declared S11 dormitory and another facility isolation zones.
We want to reduce interactions to a large extent, reduce intermingling, and then limit the number of cases that can emerge within the foreign worker dormitories. And we are also not allowing them to come out of the dormitories so that there will be no infection to the rest of the community.
At the time, it was an unprecedented move. But as the virus continued to spread, more dormitories were locked down. More than 300,000 workers were confined and told to follow rules not imposed on the rest of Singapore's population. To better understand what went on during the early days of the lockdown, we spoke to a frontline worker at a government-linked organisation. He asked that we hide his identity.
Everyone was in a panic situation. For the workers, they were also very frightened because they live in a very clustered space whereby some of the dorms are already infected.
Phone footage sent by a resident at S11 provides a glimpse of life inside a restricted zone. To minimize interaction between workers, communal spaces like kitchens were now out of bounds, and the men told to remain in their rooms. Inside, residents tried to keep their spirits up. But for many, those first few weeks were bewildering.
Just checking the temperature and pressure.
A worker whose identity we promised to conceal said they were subject to frequent tests and told to submit daily records of their temperature and blood pressure. But they received very little information in return.
A lot of them that, for example, are positive are not told they're positive, and they're being relocated from place to place to place without being told where they're going, why they are being relocated. When they go to the hospital itself, even when they're being admitted, people are not telling them that they're positive. So it's causing so much of undue stress.
Sudesna Roy Chowdhury is a medical doctor whose family was originally from Bangladesh. As the number of infections rose in April 2020, she realized there was a language barrier that needed to be addressed.
So in April, I started a translation website that helped to translate medical phrases and history taking from English to Bengali. So the idea is that you play it. Ami doctor, ami Bangla bolte pari na. Ami apnar shat. And then you just let them hear the audio so that they understand what's going on.
COVID-19 key. COVID-19.
People did use it, which is good. But I guess the shocking thing is that it's been so many months and some people are still using it or still needing translation help. So it really goes to show how unaddressed this need is.
A month into the lockdown at S11 dormitory, a worker sent us this clip.
Few days ready, the dormitory management cleaner don't have.
Cleaners in charge of his block had stopped showing up. A fence had also been erected around his building. He wondered if the residents had all been infected.
Health information is being actively withheld from them. And this would never happen to a Singaporean.
While the men in S11 dormitory tried to make sense of their situation, Singapore's Minister for Manpower paid a visit to some frontline workers. She assured journalists the government was making steady progress.
Having stabilized the situation as well as strengthened the medical support, we now need to plan for the next phase, which is about helping the workers to make a full recovery, but also for all the dormitories to go on the path of being properly recovered and to facilitate the eventual return to work for these migrant workers.
The statistics, though, were grim. That same day, Singapore registered 876 new coronavirus infections. The total number of cases stood at more than 23,000. The overwhelming majority were migrant workers.
It's physically impossible to maintain a social distance when you've got 12 to 20 people in a room. And it's not just 12 to 20 people who share a room, it's up to 100 people who can share one toilet block.
This was the exact situation Joel Mir faced when he called us from his dormitory in May 2020.
আমাদের রুম ডোর লক করে দিয়েছে, রুম আমাদের এইখানে খাবার দিচ্ছে, ভিতরে খাচ্ছি, ভিতরে ঘুমাচ্ছি, হ্যাঁ, কিন্তু রুম থেকে বের হতে পারতেছি না। আমাদের রুমে একজন ধরা পড়েছে, এই জন্য খুব রিস্কে আছি, বুঝতে পারছেন? মানে
We asked Joel to show us his surroundings. He sent us this video. Men crammed into a room lined with bunk beds. Inside the attached kitchen, a worker prepared a meal next to a row of toilets and showers. Social distancing was a challenge. Two days later, Joel told us he was unwell. His worst fears were soon confirmed.
আমি আপনাদের দেখাচ্ছি, এইখানে করোনা পজিটিভ সবারই, সবাইকে আলাদা করে রাখা হয়েছে। এখানকার ম্যানেজমেন্ট একটা রুম দিচ্ছে আমাদেরকে আলাদা করে রাখার জন্য। দেখেন আমাদেরকে কি অবস্থায় রাখছে তারা।
The management of CDPL dormitory didn't respond to our request for comment.
Hello. আপনাদের দেখাবো।
Joel was transferred to a new location 3 weeks later.
এই যে দেখেন কত ঘর বানাইছে, বানিয়ে টেম্পোরারি ভাবে রাখতেছে তাদের সিঙ্গাপুর সরকার, এখানে রেখে চিকিৎসা দিচ্ছে।
By then, it was the middle of June 2020. More than 35,000 migrant workers had tested positive for COVID-19. But the government's response had markedly improved.
এই যে দেখেন, এটা রুম।
Workers who had the virus but were asymptomatic or had relatively mild symptoms were moved to facilities like this.
এই যে খাবার দিচ্ছে, খাচ্ছে, দেখেন এই যে সরকারি খাবার সরকারে দিচ্ছে।
Other workers were also messaging us from isolation facilities. Many said they were relieved to be out of their dormitories. They felt safe in their new surroundings.
যেমন বেড, পিলো, ম্যাট, তোষক, তারপরে তোয়ালে, বিরাস পেস্ট বা স্যান্ডেল। এখানে ডাক্তার, নার্স সবাই বেশ ভালো।
Some workers were even placed in luxury hotels.
Food, drink, snack, all are complete. I want to say the government, congratulations.
Allowing the crisis to occur was clearly where the government had dropped the ball, but it was a good response after the errors had been discovered, and credit to the government that it did spare no resource.
But as elsewhere in the world, the constant restrictions were exacting a hidden toll. In August, we received videos purportedly of workers attempting to take their own lives. We've decided to blur the footage. Frontline workers we spoke to confirmed that as the lockdown wore on, mental health issues were a cause for concern.
Workers were mainly asking what is going to happen to them. How are they going to get their salary? Boys called me up, they were in hotels locked up for 10, 15 days, and some went on to be locked up for 40 days. Frustrating as it is, like isolation, what it can do to you, some of them wanted to commit suicide.
After COVID, then problems started. Yes?
At migrant rights NGO Transient Workers Count 2, volunteers said they were also receiving more calls for help. Many were related to salary issues. The Singapore government had promised that all migrant workers would be paid during the lockdown. To help make this happen, it gave their employers a tax rebate. But not everyone received their full wages.
Some of them said they've not been getting any money at all. And what's happening? Others have been getting rather less than they expected, or rather less than the salaries that had been contracted. And they were wondering, what is this? What does this represent? Is this my salary, or is this partial, or is this what?
It wasn't only workers in locked down dormitories and isolation facilities who needed support. The NGO's soup kitchen saw a steady stream of men each evening. Some had suffered workplace injuries and were awaiting compensation. Others said they had been cheated by their employers. Many had paid agents hefty recruitment fees for their jobs, but were now unable to work.
There were all these complications that made life very difficult for workers who had already launched their cases prior to COVID, and then everything slowed down and they got stuck. And of course, getting stuck has financial implications, like who's going to pay the rent? Where is money for food going to come from? And so we've had to intensify our help to all these workers to get them through this period.
এই যে আমার রুম ভাই, এটা হলো আমার রুম। আজকে 20-25 দিন হইবে এখানে মাইনে রাখছে।
Because of the pandemic, some workers who were supposed to go home found themselves stuck in Singapore instead.
আমার পারমিট শেষ হয়েছে ফেব্রুয়ারি মাসের 18 তারিখে আমার পারমিট শেষ হয়েছে। আমার যাওয়ার কথা ছিল তখন, কিন্তু আমি এখন কেন যেতেছি? যেতেছি আমার বসের কারণে, সিঙ্গাপুরের গভর্নমেন্টের কারণে আমার এতদিন লাগে এখন পাঠাইতেছে বাংলাদেশে। কোনো টাকা পয়সা দিয়ে কিছু হেল্প করে নাই, রাখছে, খাওয়াইছে, ভালোই আছে, কিন্তু আমি তো ভালো থাকলে হবো না। আমি বিদেশ আসছি কি জন্য? আমার ফ্যামিলির জন্য আমি বিদেশ আসছি।
Amanuddin lost his job because his employer couldn't pay a government levy. Because of the pandemic, his flight to Bangladesh kept getting rescheduled.
এই যে দেখেন ভাই, এই কজন লোক মাত্র যাইবো।
After months of uncertainty, he was finally getting on a plane. We met him outside the airport in Dhaka. He said he was coming home poorer than when he'd left.
এটা আমি আসলাম কেন? আমার তো ওখানে কোনো কাজ কাম নাই, আমি কি করবো? আমার তো ফ্যামিলি আছে, আমি তো ওখানে শুয়ে বয়ে থাকতে হইব না। আমি বাংলাদেশে এসে কাজ কাম করবো, কিন্তু ওখানে তো কোনো কাজ কাম করা যায় না। আমি 5 মাস যাবত ওইখানে শুয়ে রয়েছি, আমি কোনো কাজ কোনো কিছু করতে পারি না। আর কোনো দিক দিয়ে আমার কোনো টাকা পয়সা আসে না, গভর্নমেন্ট থেকে আমার কোনো টাকা পয়সা দেয় না। এটা
18 miles north of Dhaka, another migrant worker's family was hoping he would come home soon. Joel Mir was still in an isolation facility in Singapore. He'd sent us a message a day earlier.
তো আসলে অনেক কষ্টে আছি, দোয়া করবেন আমার জন্য।
Joel and his wife spoke to each other regularly. But when he first tested positive for the coronavirus, he'd kept it a secret from his family.
আমি অনেক জিজ্ঞাসা করার পরে, অনেক কিছু করার পরে পরে হ্যাঁ বলেছিল হ্যাঁ হয়েছে কিন্তু সমস্যা নাই ভালো হয়ে যাবে
Mosamat said she was struggling to put food on the table. Her husband was the family's sole breadwinner, but he was still unable to work, and his employer was only paying a fraction of his basic salary. He'd not been sending money home.
হ্যাঁ তার বাবাকে দেখতে পারছে না যা খেতে চাইছে তা দিতে পারছি না টাকা পয়সা নেই কিন্তু লকডাউন না থাকলে করোনা না থাকলে ভালোভাবেই চলতাম
By December, Singapore seemed to have weathered the worst of the crisis. The government announced that most of the country would move into a new phase. It eased capacity limits at some public venues and allowed bigger social gatherings. But migrant workers in dormitories were expected to follow a different set of rules.
They are not allowed to leave dormitories unless they have the employer's permission. And I think that's a terrible violation of any human being's rights. To say that you can go to work, but you are put back in the dormitories and you cannot even leave your place of residence.
The Singaporean government declined our multiple requests for interviews or a statement about the issues raised in this film. But in a report posted on the Ministry of Manpower's website in December, it admitted that early measures taken to deal with infections in the dormitories were inadequate. The government said it acted swiftly and decisively to stabilize the situation. And by August, all migrant workers living in dormitories had been tested at least once. The same report revealed that 47% of workers living in dormitories, or about 152,000 men, developed a COVID-19 infection.
The sheer degree of spread was so profound that it was probably very difficult to do much more than what the government had done, given the sheer magnitude of the challenge in terms of the numbers of workers and the fact that the system was just not ready to cope with such a large humanitarian crisis on Singapore's own shores.
Singapore isn't the only country where migrant workers have been disproportionately affected by the pandemic. It's been a problem elsewhere in Asia and the Middle East. But here at least, the crisis forced the government to confront an issue that hadn't been a priority in the past. It led authorities to mandate better living conditions for the workers. Some say those improvements were long overdue.
Some people expect workers to be grateful for everything that has been done for them, but if you really analyze the situation, it is only the bare minimum because it is the employers and the policies and indirectly the government that has put them in this position in the first place. So it's really only fixing what was broken by the country in the first place.
For many of the men who were affected, the experience was a traumatic one. We met Joel 7 months after he tested positive for the coronavirus. His employer had moved him into a private apartment.
ওইখানকার মানে এত কষ্টে গেছে বলার মতো না যে আমরা করোনায় আক্রান্ত মরেও যেতে পারি কি হবে আমার বাড়িতে আমার বেবি আছে আমার ওয়াইফ আছে আমার আব্বা আছে আম্মা আছে এদের কি হবে যদি মরে যায় খুব টেনশনে ছিলাম আমি আগে করতাম এই কাজগুলা এখন তো আর করতে পারি না
Other migrant workers had started going back to work. But Joel couldn't because of a hand injury sustained on the job before the pandemic hit. He'd not been able to get it looked at during the lockdown, and his boss refused to file an insurance claim.
ইন্স্যুরেন্স ক্লেম করলে কোম্পানির দুর্নাম হয় ঠিক আছে আর তোর যদি হাত ভালো হয়ে যায় তুই নেক্সটে আসতে ভালো হবে, সিঙ্গাপুরে আসতে চাইলে সমস্যা হবে না। তো আমি কিছু টাকা দিয়ে দেই, তো এমনিতেই চলে যায়।
He'd survived the virus, but was going to be sent home with an injury. And yet, for all that had happened, Joel said he still saw Singapore as a place of opportunity.
আমি এই সমস্যায় পড়ছি, তারপরেও আমার বন্ধুদের বলবো যে অবশ্যই আসতে, কারণ সিঙ্গাপুরে কাজ আছে, সিঙ্গাপুরে কাজ পাওয়া যায়, কিন্তু আমাদের বাংলাদেশে কাজ নেই।
If they come, they will join a community facing even greater restrictions to its freedoms. A community at the mercy of events and policy decisions beyond its control.